Failed the NCLEX? Don't know what to do next? If these words resonate with you, let's take a moment to acknowledge that feeling, that sinking sensation in your stomach, the disappointment, the frustration. It's completely normal to feel this way. After all, you've put in countless hours of study, sacrificed social outings, and maybe even pulled a few all-nighters. It's a tough pill to swallow, but it's crucial to remember that it's okay to feel upset. In this moment of dismay, it's easy to feel alone, like you're the only one who's ever stumbled on this path. But that's far from the truth. Many have walked this path before you and stumbled, only to rise and reach their destination. In fact, a significant number of nursing students don't pass the NCLEX on their first attempt. It's not an indication of your ability or potential, but rather a testament to the rigorous standards of the exam. The National Council of State Boards of Nursing reports that, on average, nearly 20% of U.S. educated first-time test takers don't pass the NCLEX. That's 1 in every 5 students. But here's the silver lining. A staggering 72% of those who take the test a second time pass. And the pass rate only goes up with each subsequent attempt. So let's take a deep breath and dust off that disappointment. This isn't a dead end, but a detour, a chance to regroup, reassess, and rebuild your strategy. It's a moment to learn, not a moment to wallow. In the grand scheme of your nursing career, this is but a minor hiccup. Think of it as a challenge, a rite of passage, a stepping stone. And remember, the most successful people aren't those who never fail, but those who never quit. So pick yourself up, shake off the dismay, and get ready to tackle the NCLEX with renewed determination. Remember, failure is just a stepping stone towards success. What went wrong? It's time to figure that out. You've faced the disappointment of not passing the NCLEX, and now it's essential to understand where you faltered. This isn't about dwelling on failure, it's about embarking on a journey of self-improvement. The NCLEX Candidate Performance Report, or CPR, is your roadmap here. This report isn't just a score sheet. It's a detailed analysis of your performance, highlighting the areas where you shone and those where you stumbled. Understanding this report is like peering into a mirror that reflects your academic strengths and weaknesses. The CPR breaks down your performance into different content areas, such as safe and effective care environment, health promotion and maintenance, physiological integrity, and psychosocial integrity. It further subdivides these into subcategories, giving you an in-depth look at your performance. Don't be discouraged if your report shows multiple areas of weakness. Remember, this is not a reflection of your potential as a nurse, but rather a starting point for improvement. Now, how do you make sense of this report? Each section is color-coded with green indicating areas where you met the standard, yellow for near the standard, and red for below standard. If you see a lot of red, don't panic. This simply means these are areas you need to focus more on during your review. Once you've identified your weak areas, dig deeper. Ask yourself, why did you struggle in these areas? Was it due to a lack of understanding? Or perhaps you didn't allocate enough study time for these sections. Self-reflection is a powerful tool in this journey. Remember, this evaluation isn't about beating yourself up over past mistakes. It's about learning from them and paving the way for a better, brighter future. So take a deep breath, grab that report and dive in. Understand your weaknesses, embrace them, and then set out to turn them into strengths. Because that's what nursing is all about. Continuously learning, growing, and improving. Knowing your weak areas is the first step towards improvement. A well-structured study plan is your roadmap to success. Let's delve into the creation of a study plan that will help you conquer the NCLEX. It's like setting up a GPS for your learning journey. You've already identified your weak areas from the previous step, and now it's time to focus on them. Think about your study plan as a personalized guide, tailored to your needs and learning style. Start by breaking down the NCLEX content into manageable chunks. If pharmacology is a challenge, dedicate more time to it. If you're acing questions on patient care, perhaps you can allocate less time to that area. Remember, your study plan should reflect your individual strengths and weaknesses. Now, on to setting realistic study goals. It's important to be honest with yourself here. If you know you can't study for 8 hours a day, don't schedule it. Start with what you can handle, maybe it's 3 hours a day, and then gradually increase your study time as you get used to the routine. Balance is key, so ensure you're still allowing time for rest and relaxation. Once you've got your study hours decided, it's time to plan out your study materials. You might find Saunders' RN Review book beneficial for its comprehensive content review, or perhaps the Nursing Made Insanely Easy book, known for its simple and engaging explanations. Remember, variety is the spice of life, and it applies to your study materials too. Make sure to include practice questions and simulations in your study plan. They are a great way to apply what you've learned and identify areas you may still need to work on. Lastly, consistency is your best friend. Stick to your study plan like glue. If you've planned to study cardiac system on Wednesday, ensure you do it. If you've scheduled a break on Sunday, take it. Your study plan is your personal commitment to passing the NCLEX. Think of it as your contract with success. And remember, the only person you're accountable to here is yourself. This plan is your ticket to turning a setback into a comeback. So, let's get planning, and let's get passing. Equip yourself with the right tools. Kickstarting your NCLEX bounce-back strategy involves sourcing the right materials for your review. Two of the most recommended resources are the Saunders RN Review book and the Nursing Made Insanely Easy book. The Saunders RN Review book is a comprehensive guide that caters to all the areas you will be tested on in the NCLEX. It covers everything from medical surgical nursing to mental health and pediatric nursing, all the way to community health nursing. This book is filled with detailed, easy-to-understand explanations, accompanied by practical examples to help you grasp each concept. Then there's the Nursing Made Insanely Easy book. Now, this isn't your traditional textbook. It's packed with fun and engaging ways to learn and recall complex nursing concepts. This book uses humor, mnemonics, and illustrations to deliver information in a digestible format that sticks. It's like having a friendly tutor by your side, turning the daunting into the doable. The beauty of these two resources is that they complement each other. While Saunders RN Review provides an in-depth understanding, Nursing Made Insanely Easy makes sure you remember what you've learned. Both books also come with practice questions to test your knowledge as you go along. These resources are not just for reading, they are tools for active learning. Highlight key points, make notes in the margins, create flashcards of important concepts. The more you interact with the material, the better you will understand it, and the more likely you will be to remember it during the exam. Remember, it's not just about studying harder, but studying smarter. These resources are carefully designed to help you do exactly that. They focus on the areas that matter, and present them in a way that facilitates understanding and retention. So don't let the first setback define your journey. Equip yourself with the right resources, invest time in understanding them, and practice, practice, practice. The right resources can make a world of difference in your preparation. The more you sweat in practice, the less you bleed in battle. This ancient saying rings as true today as it did centuries ago, and it's especially applicable when preparing for the NCLEX. One of the most effective ways to prepare for this challenging exam is to take practice tests. You might wonder, why should I take practice tests? I've studied the material, isn't that enough? Well, let me tell you, it's not just about knowing the material, it's about knowing how to apply it. Imagine you're training for a marathon. You wouldn't just read about running techniques and expect to perform well on the day of the race, would you? No, you'd lace up your shoes and hit the pavement, training your body to withstand the strain of long-distance running. Similarly, practice tests train your brain to handle the rigors of a lengthy, intense exam, like the NCLEX. But the benefits of practice tests don't stop there. They also help you understand the exam pattern. The NCLEX isn't your typical multiple-choice exam. It uses a unique computer adaptive testing format, which means the difficulty of the questions you receive adjusts based on your previous answers. By taking practice tests, you'll become familiar with this format and learn how to navigate it effectively. Moreover, practice tests build stamina. The NCLEX is a marathon, not a sprint. It can last up to 5 hours, and you'll need to maintain focus and energy throughout. Practice tests help you build the mental endurance required to stay sharp for this long. Finally, practice tests can help reduce exam anxiety. Going into the NCLEX, you'll know what to expect, and this familiarity can help alleviate those pre-exam jitters. In essence, Practice tests are a sort of rehearsal for the main event. They allow you to identify your strengths and weaknesses, understand the exam format, build stamina, and reduce anxiety. So remember, practice isn't just about getting it right, it's about ensuring that you can't get it wrong. So, practice until you can't get it wrong. Your mindset matters as much as your knowledge. Remember this because it's a cornerstone in your journey towards acing the NCLEX. Your attitude, your spirit, your motivation, they all play a crucial role in your success. You see, the NCLEX isn't just a test of your nursing knowledge. It's also a test of your resilience, your determination, your grit. It's a marathon, not a sprint. And like all great marathons, it's not just about the finish line, it's about the journey. So how can you stay positive and motivated during this journey? Firstly, remind yourself why you're doing this. You're not just studying to pass an exam. You're studying to become a nurse, to help people, to make a difference in the world. Keep this big picture in mind and your motivation won't wane. Secondly, practice self-care. Stress can be overwhelming, but it's manageable. Take regular breaks, get plenty of sleep, eat healthily, and exercise regularly. These simple routines can drastically improve your mood and energy levels, making your study sessions more productive. Thirdly, surround yourself with positivity. Positive people, positive environments, positive thoughts. If you feel like you're struggling, reach out to your peers, your teachers, your loved ones. They're your support system, your cheerleaders, your safety net. They can help you stay motivated and focused. Fourthly, celebrate small victories. Every chapter read, every practice question answered correctly, every concept understood. These are all wins. Celebrate them. They're proof that you're making progress, that you're one step closer to your goal. Lastly, don't be too hard on yourself. Remember that everyone stumbles, everyone has bad days, everyone feels overwhelmed at times. It's okay to feel this way. It's okay to take a step back, to recharge, to regroup. Don't let temporary setbacks dampen your spirit. In conclusion, staying positive and motivated isn't just about thinking happy thoughts. It's about taking care of yourself, keeping your eyes on the prize, and embracing the journey. It's about resilience, determination, and positivity. And remember, believe in yourself and you're halfway there.